Hello friends, I would like to talk about the surgical options in patients with scoliosis. Now, as we all know, we try our best so that the patients don't progress to the level of needing surgery, but more often than not, we are hard pressed into offering surgical options to the patients. Whenever we discuss about surgery for spine, the primary concern is that the spine surgeries are associated with a lot of risk and complications. Over the years, multiple surgeries and research have been carried out, especially for scoliosis, in order to make the scoliosis surgeries as safe and as efficient as possible. So let me discuss what is a fusion surgery for scoliosis. Fusion surgery is a definite surgery for scoliosis, which essentially means that the curvature of the spine will be corrected as much as it is stable and suitable for correction. That is number one. Number two, we will be putting implants in the form of screws and rods. Thirdly, in order to ensure that the correction that we obtain remains the same, we will also do something called as bone grafting and fusion, so that this correction that we obtain stays with the patient for the rest of their life. So it essentially means that we make a skin incision along the length of the scoliosis. We identify the bones which are maximally rotated and deviated. Using specialized techniques, we put something called as pedicular screws into the spine, and once we have that, we try to do some bone cutting so that whatever deformity is there, we are able to correct it. Once that correction is obtained by a procedure called as osteotomies, we put rods and then we do correction maneuvers during the surgery so that we are able to get the best correction. Once this is done, we do bone grafting so that the entire chunk of bone acts as one and the correction that we get remains the same. In order to make it safe and efficient, we do multiple things such as controlling the amount of blood loss. Second, ensuring that there is precise placement of the screws, especially in the bones which are deformed. And most importantly, we take steps so that the spinal cord's health is not jeopardized. Hence, we do the entire procedure under neuro monitoring and we get real-time data about how well the spinal cord is functioning.